Hello and welcome to the Myland Institute at Queen Mary University of London and to another in our series of videos on the global pandemic. Once again we'll be hearing from Professor Sophie Harman. Sophie is going to look today at the great news that we have a workable vaccine from Pfizer and BioNTech, which is hopefully going to be given emergency approval anytime soon. Sophie looks at vaccine nationalism, vaccine hesitancy, and what exactly is going to happen when we do get this vaccine. If you enjoy this video, please do tell your friends about it, and please do go to our website to find out more about the Myland Institute and sign up for our newsletter.
At last, this could be some good news in 2020 with Pfizer's announcement that there could be a COVID-19 vaccine by Christmas. Now, of course, this is extremely exciting news and is a testament to the efforts of scientists, the academic community, and volunteers who participated in all the clinical trials, and is some much needed hope that we really need to get behind. This is all, of course, extremely exciting. However, there are some questions that we need to pause and consider before we get carried away around vaccines. The first is, of course, who gets it? Now, in the UK, there's been the introduction of a tier system, which seems to be the government's favourite word, in which the most vulnerable will have access to the vaccine in different tier stages. This makes complete sense. Get the vaccine out to those who most need it. This then gets a little bit more complicated on the global stage when you see people talking about vaccine nationalism. Now, vaccine nationalism has been around for years and was a particular problem in the HIV and AIDS response, but it's not just limited to that. The problem here is when rich states predominantly hoard vaccines or reproduce vaccines that are affordable to them, but not necessarily affordable in lower or middle income countries where the vaccines tend to be needed. This creates huge inequalities in global health and also vaccine access. Now, the good news around vaccine nationalism is because it's been around for so long, many members of the vaccine and global health community are aware of it and knew that this could be an issue with COVID-19. As a consequence, Gavi, which is the kind of vaccine alliance around the world, has set up what we call COVAX in partnership with other institutions such as the World Health Organization. Now, the idea of COVAX is that member states around the world pay into this organisation to ensure that should a vaccine become available, that those people living in lower income countries will be able to access it. Now, this is also not just this kind of great effort or moment of kindness by rich countries. It also comes back to this idea of global health security, that you're only as safe as the least safe person, in effect. So you have to vaccinate everyone in that sense. So this is very positive that people are taking these measures and you see COVAX being established before the vaccine's actually in existence or being created. Now, of course, the interesting part will what be happening once the vaccine arrives. Will member states commit to this? And what's slightly concerning is you're starting to see tinges of vaccine nationalism come into kind of mainly the UK rhetoric around the vaccine. Don't worry, we've bought all these vaccines. We're going to be fine. We're going to be in there first. Our citizens are going to be vaccinated before anyone else. That language is potentially reassuring to the public, but is not reassuring to the global health community, who are worried about this kind of shared vaccine commitments. Okay, that's who gets it first. The second issue is who delivers the vaccine. Again, in the UK, vaccine delivery is going to come under the NHS. So there will be less outsourcing to private companies that have been controversial in other aspects of the response. And I think there is an expectation here, particularly within government, that they cannot mess this up. That if the vaccine comes available, if science delivers, the politics have to be right. And this then relates to the wider question of, well, who actually wants the vaccine? Now, hopefully, none of you watching this will be people who don't want the vaccine. You want the vaccine, you want life to go back to normal, and you see this as possibly a way of doing it. However, vaccine hesitancy or vaccine denialism is real. It's existed as long as vaccines have existed. It's not just something that, I don't know, your crazy uncle or auntie have sent you in a WhatsApp chat. It's always been around. The problem that you need to think about is the kind of factors that lead to exasperated sort of tensions around vaccines. And this is a concern for the UK because research shows that one of the factors is trust in public institutions, not so great, trust in elites, hopefully a little bit better in the UK than over the last few years. And there's a correlation between people who vote for, say, populist leaders and populist parties and certain beliefs over vaccination and anti-vaccination. So there are these kind of trends there that are of concern. It's also linked to kind of histories of vaccinations and histories of how vaccinations have been used within specific countries or contexts around the world. This is less relevant perhaps to the UK, but it's been extremely relevant in countries such as Pakistan and Nigeria. And again, if you want to look at successful models of how you tackle this issue of trust with vaccines, there are a lot of case studies around the world that we can draw on within the UK. So I really would encourage anyone who's working on this to really look at what has worked in terms of polio vaccination, measles vaccination, and even the Ebola vaccination, which I'm going to come back to at the end of this video. So who wants it? Surprisingly, more controversial than who gets it, and not an issue that we can just hope goes away. It's also an issue that is not going to go away by demeaning or rubbishing those people who have these kind of concerns around a vaccine. If we've learned anything from Brexit and the Brexit debate in the UK, taking oppositional sides tends to foment oppositional positions. It doesn't change your debate on that. So this is about bringing people in. And I think that's one aspect of hope actually around the vaccine that you can see, is this involvement of citizens at every stage of the vaccine process and trying to build, if not trust in public institutions, but trust in science in that respect. The final issue I want to reflect on a little bit is something called vaccine security, which you don't really hear much about. Vaccine security in the first instance really refers to the security over healthcare workers who deliver vaccines. And now this has been a huge problem, particularly again in these two case studies I mentioned before, in Pakistan, in Nigeria, and in Syria to an extent. Attack on healthcare workers and vaccinators around the world. And these really, this is one of those issues that really upset people in the global health community, where we see our colleagues doing really important work being attacked for what they're seen to represent and not being able to do their work in effect. So when we think of vaccine security, it normally refers to healthcare workers. However, there's a wider question around vaccine security in actually who has access to the vaccine. So if we think about the cyber attacks on the email accounts of researchers working on the vaccines, that gives you a real kind of clear example of how the vaccines are going to be an important commodity in the world in the next year. Who is going to secure those vaccines? So this is not just an issue necessarily of securing the vaccines in their physical form, which of course is one aspect, and who's going to do that? Is it just GP surgeries? I don't think so. The other question is who actually then protects the research behind it and the intellectual property, and how is that going to be threatened by modern forms of cybersecurity? So vaccine security is very much intertwined with these issues of cybersecurity that really I don't think we've sort of thought about or thought through that much, and could potentially become a growing issue within global health security in the future. So to sum up, exciting news. Let's all feel very positive about this. Yay for science. However, I don't mean to be a downer about this, but there is so much politics to the vaccines. If you thought the politics around track and trace, stay at home, behaviour change was political, you ain't seen nothing yet.